Should tattoos be allowed in physical therapy? And not just tattoos, but we get asked, hey Tony, is it okay if I have piercings? Or is it okay if I have a big beard? Like, will this hurt me when I try to get into the PTA program or the PT program, or when I get a job, or will it affect my treatment sessions? And that's what we want to talk about today, is will my appearance influence all those things?
Appearances do impact the way people see us. So whether we want it to or not, or whether we think it should or shouldn't affect the way people think about us, presentation does matter. So one of the things I think of is if I go in a restaurant and when I first walk in, maybe it's cluttered or it looks dirty, maybe the floor looks like it's not clean, I automatically assume how the food's gonna taste or whether or not I should eat it just based on the initial presentation. It could be like the cleanest kitchen ever and the chef could be fantastic, but just because I saw something maybe that wasn't so clean when I first walked in, it impacts the way I perceive the whole experience.
I remember back when I was in high school, I saw one of my teachers outside of class at a restaurant wearing normal street clothes, like wearing jeans and a t-shirt and drinking a margarita, you know, and that totally caught me by surprise because I've never seen him dressed like that. I always see him in a nice button-up, wearing a tie, and it just caught me off guard by the way they presented themselves. It totally gave me a different look of how I saw them as a person because they were dressed differently.
And this shirt actually came about because of a patient. I had this patient that was like 8-10 years old, and I always prefer to wear like gray or black, something simple. Well, she said that this color made me look happy and fun. So the color of something even changed the way she perceived me. So did the way that we dress change the way that you perceive us? Tony in a hat?
I never wear hats.
Or me in my bright colors? Did it influence you? Did it change the way you see us?
Now back to the conversation of having tattoos. Patients ask us, no, I meant to say do people ask us, not patients. I messed up there. You know, does having a tattoo on my body impact my skills? Does it affect my actual treatment strategy? And the answer is no. You know, having a tattoo on me or off of me, it doesn't really impact what I learn in school and how I provide care.
Right, but does having a tattoo impact how the patient receives your skills? And the answer is yes, because it's not just like that one exercise or that stretch you're providing, it's the experience that the patient takes in, and that does influence it. Whether it's good or bad, it does just influence the way they perceive you.
A way that having a tattoo could actually benefit you is if the patient has a tattoo, or if the patient can relate to that. Sometimes you guys can connect on a deeper level if you guys both share that common interest. Hey, how's it going? My name's Tony. I'm the physical therapist here. I'll be working with you today.
Nice to meet you. And where did you get yours done? I was debating whether or not I want to color.
Oh, I got mine done at, I don't know any tattoo places.
In a way that it could be like a negative, maybe, is if a patient perceives the tattoo as something negative. Maybe they associate it with drugs, or maybe they associate it with violence or gangs or something, or maybe they just think of it as like mean people or something.
Hey, what's up? I'm Prison Mike.
Does this guy even know what he's doing?
I can't even do this.
I'm Prison Mike.
Whether it's right or wrong, sometimes that's just their impression on first seeing somebody.
So are tattoos allowed in physical therapy? The answer is it depends. You know, it depends on what program you decide to go into. It depends on your boss or your employer or the clinic you work at, if they allow them, or the handbook or the policy at the hospital, whatever it is. It depends on where you choose to work. Some places they allow it and some places they don't. And if your facility or the college you plan on attending doesn't allow tattoos, that doesn't mean you can't have one. It just means you might have to cover it up. So for your clinicals or for your practicals or while you're in the program, you might just have to cover up your tattoo.
And then when you go to look for a job, just err on the safe side, keep them covered, and then just find out what the handbook says. So if you get a job at a facility, if the handbook specifically says, you know, this is our policy, then that's the way it would be. And it's the same for like whether you had a facial hair or whether you had like different hair color. Like usually in the handbook it says whether or not something's allowed within that company.
So the thing we want you to remember then is that our choices matter. You know, whether we choose to get a tattoo, we choose to dye our hair, we choose to do anything with our appearance, it influences other people.
So be mindful of the way you present yourself.
Thanks for watching the video, guys. Be sure to let us know in the comment section if you think tattoos should be allowed or shouldn't be allowed in physical therapy, and like the video, share it with a friend. Peace.